Hello and welcome back to the Lynn Lowdown. I'm Danny Vittori, and today we are going to be discussing the services of Lynn Community Health Center with their new CEO. Thanks for joining us today.
Hi, I'm Brenda Rodriguez, the new Chief Executive Officer of Lynn Community Health Center, and I'm very happy to be here with you today.
Great, and you've been in this role for a little over 2 months now.
Yes.
How's it been going there?
I mean, Lynn, as you know, is a vibrant community, and our health center is no different. It's dynamic, there's so much going on, and I just jump right in.
And going into it, did you have any specific goals or places that you wanted to target, or was it a bit more of a general approach?
I mean, I would say it's a general approach, but intentional. Mm-hmm. And so Lynn is a special place, but it's unlike other healthcare organizations in that we're here to serve the needs of our most resilient patients, our most resilient and strong community members who have barriers to access. And so first and foremost, as a longtime community health center patient, my intention is always to improve patient access and to make sure that we're doing right by our community members and improving their healthcare outcomes and treating the whole person.
And you just mentioned it a little, but what initially attracted you to this job when you saw it?
I mean, the organization, we found each other, and so I'll say that. And my heart is for the community. I care about health equity, reducing healthcare disparities, and that is my life's purpose, and that's my personal mission. And I know being here at Lynn Community Health Center, serving this community, that I can do that. And I hope that I can make a difference, and I believe that I can.
Definitely. So you can just even tell from 2 minutes how passionate you are and how much you care. And why would you say it's so important to have a health center like this here in Lynn?
Well, Lynn Community Health Center, we are the largest healthcare practice in this community. We are the best answer, and we're really the main solution for patients and community members that have complex needs. Mm-hmm. Our patients have many desires, and really the health center is one of the unique places that can address their comprehensive needs. So whether it's behavioral health services, whether it's primary care, prenatal services, whether they need assistance with housing or transportation, whether they need a patient advocate, whether they need assistance with a referral and getting to a specialist. There are very few practices that can do that, and we're well equipped to handle those needs, and we're very proud of that work.
You allow it to be a little more of a one-stop shop kind of thing. Instead of having to go to 5 different places, they can go to you and get some of the services they need.
Yes.
And you mentioned it a little bit, but one big thing that was opened within the last year was also an in-house pharmacy.
Yes.
So how does that help people too?
So we are very proud of managing a pharmacy right on site with our partners, with C3. And it provides, first of all, patient access. And so our patients, they can be seeing their provider, their clinician, and right there in our building, and it's very convenient for them, they can get the medications that they need. They can also receive more education around their treatment. And so in terms of integrated care, it helps with that. And I think that is what every patient deserves, every community member needs, not only access, but the confidence and assurance that they're getting this service in an integrated way, where their clinician, their provider, and everyone across this care of services knows what they're receiving, and they're aware of how this is helping them with improving their health.
That understanding. And one thing you mentioned earlier, which I thought was interesting, is you say you treat the whole person. What did you mean by that?
We treat the whole person. We treat the whole person. So, we have patients and community members that, they may come in because they have issues with hypertension, let's say. And so, but we may, in consulting with them, realize that really, we want to help them manage their stress better. So we work in a collaborative fashion with our other care team members to ensure that whether it's advising them on stress management, whether it's actually looking at their medications, or advising them around their nutrition, or really assisting them with something that their family needs, whether that is related to schools or the transportation or housing, that we're doing that. So we are full human beings, and we really, when we're treating our patients, we really need to look at the entire person and their entire needs. And that is about dignity and respect when our patients are coming to see us.
Definitely trying to get to the core root of what's happening, not just treating symptoms.
Absolutely.
And I said you've only been here a few months now, but
yes.
Which is amazing. I mean, it seems like you've already accomplished so much, but going forward into this next year, what do you hope will happen within your first year as CEO?
So I actually today had shared with the entire organization my year one goals, so things that I'm personally going to be driving. And so there are 4 areas that I'm focused on right now in order to set the foundation for these big, bold moonshot things that we want to do in the future. But first, we want to get our house in order. First, we want to get back to some basics. And so what does that look like? For us, that's looking at our roles and how we're defining the work that we're doing, how we're structured, and making sure that we're all clear on our responsibilities and we're supporting each other. And so we want to make sure that we put the right staff investments in there to do that. We're also going to be engaging in a new strategic planning process. And so around every 5 years or so, usually companies and organizations, they look at their goals, they look at their vision and their mission, and we're going to go through the exercise of looking at our organizational values, making sure that they're driving the right behaviors, and making sure that we are setting the course for what our organization is going to do and the impact it's going to have over the next 5 and 10 years. We're focused on inclusion, making sure that every member, every colleague feels valued and knows that they're making a difference. And we want to make sure we have programming to make that systematic, institutionalizing that. And the last piece that we're focused on this year, and I am personally driving, is what I call amplify with exclamation. We want to let the world know the amazing work that we're doing here in Lynn and that our colleagues are doing. We want to elevate patient voices and patient stories. And so we're hoping that our funders and our partners and our stakeholders in the community hear and see the beautiful gem that is Lynn Community Health Center and the work that we're doing.
And you are already doing that. I even saw on Facebook you post bios of your staff members so people get to see them, you know, put a face to a name and hear their stories.
Absolutely. We started a campaign because for Women's National History Month, we wanted to recognize and celebrate the women across our organization from different roles. And so the beauty of healthcare and being in a community health center, we have providers, clinicians, we have community health workers, we have nurses and people in marketing and in IT and finance. So we, Women Power, we have, we touch so many different aspects of healthcare, and we deserve to be recognized. And certainly, yes, that is what we're doing, celebrating our women this month, but every day.
Yeah, every day. And I said, I love the campaign, the way you were doing that.
Yes,
it was really great. So another thing you mentioned too was the community support program, the community aspect of it. Did you want to touch on that, how that works?
Yeah, so the community support program essentially is, we've been doing as a healthcare organization, we've been doing work out in the community for decades. The difference now is that we're organizing those efforts. And so our community support program includes patient navigators, community health workers that are helping patients from everything from just understanding how to make an appointment and how to get a referral to a specialist, all the way to really helping them with transportation, assisting them with, if there's food insecurity, making sure that we are connecting them to those services. And related to that, we also have a very robust benefit enrollments team. So as we have people that are either, whether they're new arrivals or they've been part of the Lynn community for decades, we want to make sure that people have insurance and they understand the insurance products that are out there for them. And so there's a lot that we're doing, but the community support program is a vital component and an area that we're investing in, and we hope to see the impact in the Lynn community.
And between that and the outreach and everything you do, you really you try to impact the whole person, the whole community. And I do have to wrap up in a moment, but was there anything else I hadn't touched on that you wanted to mention?
I would just say that, don't count us out. Lynn Community Health Center is a vibrant place, and we serve patients from all walks of life, and we're very proud of doing that. And just want to thank the community, and thank you today for giving me the opportunity to share our story.
Of course, thank you for coming on. I said, you can just tell the passion coming off of you, and I'm so happy you were able to come on and share some of that with us.
Thank you. Thank you.
Of course, thank you. And once again, I'm Danny Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.